Good morning, everybody. I shall be presenting on orbital lymphoma, a clinico-pathological correlation. That lymphoma is a diverse group of malignancy with different histopathological subtypes and clinical presentation that vary with the geographical location. The aims of the study were to know the clinico-pathological correlation of the cases of primary orbital lymphomas, the different histological pattern, and the various modalities of treatment and the ultimate treatment outcome. It was a retrospective observational case series where 48 eyes were taken in a span of 7 years, and all cases were having primary orbital involvement, and patients with a follow-up of less than 6 months and previously treated patients were excluded from the study. Thorough clinical examination with appropriate orbital imaging, followed by incision and excision biopsies were done. Histopathology and immunohistochemistry were done to confirm. Staging workups were done with the help of hemato-oncologist, and on SOS basis, he did the other required tests like whole body PET scan, bone marrow biopsy, etc. And we had referred the cases to oncologists for further management. 48 eyes were there. 32 cases were unilateral and 8 cases bilateral. Age range were 55 to 70 years, and male preponderance was seen. Most common sign was proptosis, and the ratio between the well-defined lesion and the ill-defined lesion radiologically was 4:44. That means most of the cases were ill-defined. And extranodal marginal zone lymphoma versus non-extranodal marginal zone lymphoma, the ratio was 31:17. That means EMZL type was common. None of the cases were of T-cell origin, and 25% cases died in a 5-year follow-up. And these are the different treatments which we opted for: the surgery only, the radiotherapy only, radiotherapy plus chemotherapy, chemotherapy only, surgery plus radiotherapy. And the tumors, orbital lymphomas, all were actually E according to the Ann Arbor staging, the extranodal type, and it was categorized accordingly. And the treatment outcome were seen, and the 25 cases, they were complete remission. 4 cases showed partial remission, 4 stable disease, and in 12 cases there was death due to lymphoma or some other cause. And I'd like to highlight some of the cases, and in this case a middle-aged man presented with infromedial orbital swelling. On imaging there was a mass noted in the infromedial orbit, which was iso-intense in T1 and T2 weighted images, and excision, complete excision was possible, and histology suggested of lymphoma, and the immunohistochemistry was suggestive of expressed CD20 positivity, and it was a EMZL type of MALT type of lymphoma. This was a case where bilateral proptosis and imaging showed a homogeneous soft tissue density enhancing mass at both of the eyes. Incision biopsy were taken, and lymphoma panel investigations suggested it to be of extranodal marginal zone lymphoma. This was a case little unusual. The lady presented with the features of orbital cellulitis, but on imaging there was a homogeneous lesion, almost encapsulated, but during and planned excision biopsy, it was not possible to take it out in toto. So ultimately, an incision biopsy was done, but the histopathology, it was a diffuse large B-cell lymphoma. So the most common histology was extramarginal zone lymphoma, non-EMCL, that means diffuse large B-cell lymphoma, follicular lymphoma, small lymphocytic lymphoma, mantle cell lymphoma, or it can be of T-cell lymphoma. Immunohistochemistry confirms the diagnosis. Incidence of NHL increases with age. Now MALT, or mucosal associated lymphoid tissue, follicular lymphoma, small lymphocytic lymphoma, and earlier staging had a favorable prognosis. Poor prognostic factors included a high-grade histological subtypes and advanced staging. But the main limitation of my study was it had a relatively small sample size. Now what this study confirmed and added, the study was performed in Eastern India. Our study did not detect any T-cell lymphoma, and EMZL was the most common histology. The mucosal associated lymphoid tumor, follicular lymphoma, and small lymphocytic lymphoma, and the earlier staging had the better prognosis. Thank you.
What are different treatment modalities in your case series? Are you Of course, that is not part of your study, but how you treated your cases?
I had done, after confirmation of the diagnosis, sir, I had sent the patient to the oncologist. Now, oncologist had, apart from the surgical part, few cases the radiotherapy was done, and this is the most common thing. Because of this low-grade MALT type, EMZL type, the radiotherapy, 35 to 45 grays, it was done. And some aggressive variant like a DLBCL, apart from the surgery, the chemotherapy was given. So the treatment modality is radiotherapy only, radiotherapy plus chemotherapy, chemotherapy only, apart from the surgeries were done. And only few very rare cases complete in toto excision was possible, which I showed in the first case. But after that, I had sent the patient to oncologist and whole body PET scan was done. No hotspots were found. So I am keeping the patient under follow-up.
How do you compare this with your Western literature? Which usually we have Western literature. This is the study done from India.
Yes, sir.
So you have seen that T cell is not found.
No.
What are the other impressions from,
Sir, T cell is not found in my study. In Western literature,
any other striking feature you have found in this study? Because this is done in India or
yes,
in
sir.
Asian population.
Yes, and the age group in Western literature, in our case, it is more advanced age group. In Western literature, it comes from much earlier age.
Any other finding you have got?
Though
Histopathology same consistently, whatever you have got.
The most common here was extramarginal zone lymphomas. In Western also extramarginal zone lymphomas. I have not seen